Hello everyone, and once again welcome to my favorite channel. And today we are going to be looking at the last part of PTSD, the last stage rather, because we had looked at 4 stages. We're looking at the last stage, which is the 5th stage, which is called comorbid post-traumatic stress disorder. Comorbid post-traumatic stress disorder. What does that mean? This is a kind of a post-traumatic stress disorder which is experienced when a patient suffers from more than one mental health disorder. When a patient suffers from more than one mental health disorder, that is to say from multiple mental health disorders. For instance, someone suffering not only from PTSD but having alongside depression, anxiety, and even addiction, because there's a higher tendency that most people who are at that stage, they get into drug abuse, alcohol abuse to try to go out, to take out the pain. So this is the most dangerous and risky form of mental health disorder. It is very, very detrimental. In fact, it is the zenith or the apex of PTSD. And that goes without saying that it needs a lot of attention. A lot of attention is needed. So listen to this. Normally, it has, of course, the normal symptoms, like the other symptoms that we have been mentioning. We already know the general symptoms when it comes to PTSD. But then when we talk of comorbid now, it means it goes alongside the other things like depression, anxiety. Remember, I've covered depression and anxiety. So you also find symptoms of that. Talking also about addiction, because they want to go out of the pain. They involve in smoking of all kind of inhaling all kind of drugs and alcoholism, and it gets very complicated. It gets complicated, and believe me, because of the complicated nature of this, it also needs a more intense approach to resolve it. That's why, to begin with, and not very importantly, at this stage, there must be rehabilitation. I repeat, you need to take them for rehabilitation, because there is a form of the brain has incurred some damages. So in isolation, they will now need a psychiatrist to begin with, which will have to examine the damage of which they have undergone in their brain, because at this stage they are very, very, very dangerous, both to themselves and to the environment. They can be very dangerous, so it's risky to be around with them, regardless of the relationship that you may share. They could be even your husband, your wife, your children. At this stage, trust me, they are very, 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 very harmful. So you need to isolate them. You need to seek a psychiatrist care. Not just therapy. Therapy at this stage is kind of life. They need to undergoes a psychiatric examination alongside intense medical treatment. And then not forgetting, of course, the spiritual side, the spiritual aspect of it. So they will need to undergo a prolonged pastoral care sessions, whereby they will need much of the Word of God. Like I told you, the Word of God is medicinal. They will need to study the Word, meditate the Word, and undergo even fasting. So the pastor will put them under some fasting there. Fasting has the capacity to break the chains. If you read Isaiah 58 from verse 1, you will see the importance of fasting. So it's a very delicate stage, and please, if you have anybody suffering under this, don't hesitate to quickly report it, because it's very delicate. Make sure you report it quickly. Yeah, so this is the end of post-traumatic stress disorders. But meanwhile, stay tuned because our journey will continue. We are going to be looking at other forms of mental health disorders. Don't forget to like, share, comment, and not forgetting to subscribe and put on your notification button. See you on the next video.